Good morning to everyone. My name is Ainsa Bimangkapanga. So I will do the health assessment from the head to mouth. So let's begin with the assessing the hair and the skull and the face. So kita po siya. So what is assessing the hair and the skull and the face? So assessment client hair, including the inspecting the hair, palpating the head, considering the developmental changes and ethnic differences, and determining the individual's hair care practices and the factors influencing them. So the purpose of the hair assessment was to obtain a baseline data for subsequent evaluation to identify an abnormalities in the hair and the skull and the face. So determine any infection of infestation. For consideration before, during, and after the procedure, first explain the procedure to the client, verify the client's identity using the protocol. So things to document after the procedure, relate findings to previous assessment data for available. So good morning, sir. So I'm Ipanga Hansa. So I will be your nurse today. So I will be assessing your head. So can I ask you a question? So do you have any injury from your head?
Nope.
Thank you.
Oh.
So sir, can I touch your head?
Yes.
Okay. Then so the color is determined by the amount of melanin. Present scalp is clean and dry. Hair is smooth and arm somewhat elastic. Push.
Go.
Go. Palpate the head. If any lies. So careful inspect the hair follicle of the scalp and pubic area can reveal lice or other parasites. So evaluate hair quantity and quality, its length, density, color, and the texture.
Oh.
Inspect the hair, no dandruff or lice. So the hairline, if any lice or dandruff. So I will be assessing the head. So first, we're going to see the face is symmetrical or normal. Presence of both the left and the right side are symmetrical. So, sir, can you spell for me? Smile. So, the facial expression and the cranial nerves. 7 is the facial nerve. So, the next is I will be assess the eyes. So, what is the assessing the eyes? Eyes should be assessed as a part of a holistic patient assessment and as a part of personal. The purpose of the assessing the eye is that the eye vision the condition such as the infection and inflammation. Okay.
Oh.
So inspect the eyes. So the patient eyelashes are area distribution both the left and the right side are symmetrical. So inspect the conjunctiva. So that's it should be red. So conjunctiva is it should be redized and pink. It shouldn't be red. Okay. Palpate the lacrimal gland. Okay. So it shouldn't see any drainage or anything. Since there's no swelling, everything is normal. So let's look the prepared. So the patient's sclera looks it's normal, both left and the right side. There's no abnormalities. The patient cornea left and the right side, so cornea sclera are normal. The iris are dark brown color, both iris and same size. The normal pupil size should be 3 to 5 millimeter and equal. We proceed for assessment for the ears. So, what is assessing the ears? It's an essential skill for the pediatric healthcare provided to purposes. Purpose it is done to screen for ear problems such as hearing loss, ear pain, discharge, lumps, or objective in the ears. So, scar or skin changes and inflammatoid any push the pain up forward. So, the trap or it is external. So, there's no swelling with the cartilage. Then to the mastoid process, no swelling and masses is normal. So I will be assess the external ear and the tympanic membrane. So inspect the ears. If there's no, so the ear canal is skin colored and lined with a small hair. Usually some yellowish brown earwax. So to the other ears, pull the pena and inspect. So the patient ear canal and the tympanic membrane, patient ear canal seems with the color of the ear. There's no foreign bodies, there's no presence of cerumen or wax, which is totally normal of the patient. So assess the gross hearing acuity test. The patient and the nurse should be standing 1 to 2 feet from the patient's ear, and music can be a distraction or interference with a whisper voice test. So the next step is to try to whisper the patient from you. So let's start. So the weather is hot today. Whisper to the patient. So the weather is hot today. So can you repeat my phrase?
The weather is hot today.
So let's try to the other ears. Okay, you turn around. You are in a good condition. Repeat my phrase.
You are a good condition.
Was.
So,
So for the assessing of the nose. So what is the for the assessing of the nose? And sinuses should include infection of the interior and inferior surface of the nose.
go.
So the purpose is to determine the client history, allergies, difficulty breathing through the nose sinuses, infection, injuries to the nose surface, nose bleeding, any medication taken.
So,
Sir, can I ask you a question? So, do you have allergy in your nose before?
no,
Any bleeding to experience in those blood before?
no,
And injury, your nose, face, and medication taken.
no.
Left your head to determine the anterior of nares by lifting the nose up, and next are the nose in the midline. So pinch the nose for inspect the nares of it.
Go.
So, to assess for areas of the nose have a tenderness and displacement of disappearance of the bone and cartilage. So,
So,
to assess the potency of the deposit nares and both nasa. So, breathing, breathe out. So, it's kindly can breathe next to the left arm. Breathe in, breathe out.
so,
Observe the presence of the nasal cavity. Okay, so or redness, no redness or swelling, growth, and discharge. To provide structural support for the nose and to help regulate and ensure smooth laminar airflow through the nasal cavity.
Go.
So we're gonna palpate the senses and then to put the pressure on the two sides of the right there and the left side and the right. So there's a pencil here.
Go.
So I will palpate the maxillary to determine the tenderness. So if you feel pain, there's a pencil.
No.
Proceed with assessing the mouth. So what is assessing the mouth? An assessment done to determine any abnormalities in the mouth and pharynx. So let's take your tongue here. So okay. So the patient's lips are symmetrical, both the left and the right, and there's no lesion or no bleeding, no edema, or any problem with the lips.
Go.
So can I touch your mouth, sir? So the patient's lips are smooth.
Go.
So please open your mouth, sir. So there's no, there are tinted teeth, which is normal for the 16 years old. So the dominant color of the teeth is white and there's no maleficient. So there seems to no swelling, no pain, and no pressure of the and tongue is wait, that was it. Pressure of exudate and tongue is in the midline. So there's not deviating to the left and the right. So check the uvula. So the patient uvula is not vibrating or moving as he say, which is totally normal, and it is a pinkish color. The tonsil is our perfect normal, and there is no swelling.